Welcome back to the Whole Health Podcast. I'm excited to introduce to all of you Dr. Douglas, Dr. Leslie Douglas, who has been the principal investigator and laboratory director of DNA Connections, as well as the laboratory manager of BioComp Labs, which we'll talk about today, two CLIA certified specialty labs located in Colorado Springs, Colorado. Her background includes extensive work in genetics, biochemistry, microbiology, and immunology. In her role, Dr. Douglas oversees the development and validation of DNA testing for vector-borne illnesses and chronic conditions, contributing to the advancement of integrative and precision medicine diagnostics. Dr. Douglas is currently focused on researching and developing PCR-based diagnostic tests for Lyme disease and tick-borne co-infections, as well as creating a range of molecular-based testing assays. Welcome. Thank you for being here.
Thank you for having me.
So this is kind of our part two, because if listeners have been following along, we got a chance to talk to you about DNA Connections, which was very exciting. And now we're going to talk about BioComp. So Tell us, what is BioComp Labs?
So BioComp Labs we offer one test, and we do it so well. It's all we do. It's what we specialize in. It's a serum biocompatibility panel where we look at chemical groups that are common ingredients in dental materials. And based on your own serum sample, each one of those chemical groups comes up as least, moderate, or highly reactive to your sample. So the chemical groups are metals and nonmetals, and there's 78. These are common ingredients in dental materials. I tell people dental materials are not created equal. There are acrylamides, which are plastics, different forms of them. There's dimethyl acrylate, silicate, which is like sand and glass. Those things are common in dental materials. And then there's things like lead and mercury and barium and organic chemicals like phenol. And why are they in dental materials, right? Maybe Dr. Blodgett can clear us up on that. So each of these chemical groups come up again as least, moderate, or highly reactive. And then we have a database of over 11,000 dental products. And each one is entered into this database based on those chemical groups. So let's say you did the test and you were highly reactive to copper. Then any of these dental materials, no matter what it's used for, if it contains copper, will be flagged in the report as highly reactive to your sample, and is not recommended for use. And we have 21 categories of dental usage. So there's everything from your white fillings to porcelains and ceramics, crowns and bridges, etching materials, orthodontics. You don't think about this, but you love your kids and you want them to have a beautiful smile, and they have a mouthful of metal. And again, all those metals are not created equal, right? And then you have the whole realm of the acrylic aligners, which would be better for your child.
Mm-hmm. This is one of my favorite things to offer to patients, because to your point, all materials are not created equal. And, it's kind of funny to think I've, been a licensed dentist now for 26 years. When I graduated from dental school in 1999, there was no such thing as bondable ceramics for crowns in the back of your mouth. And my point of sharing this is that back in those days, if you wanted a tooth-looking crown, it would have a metal-based alloy underneath it. They'd bake the porcelain on top. And fast forward a quarter of a century now, the number of ceramic materials that are on the market that continue to pop out, every year or two, here's the newest, latest, greatest. These materials will look beautiful. It's very hard to tell looking at them as a block or as a crown in their tooth-shaped form, but you can't appreciate what the chemistry of that thing is unless we investigate.
Right.
So maybe we start with, how about I share the story we were just talking about as it relates to materials compatibility, because I think it's really appropriate. Here's the story. You know, I'd seen a woman probably 5 years ago. She came in, she had, it was probably 10 to 12 teeth that had mercury fillings. And her goal was to remove those and put materials in that would be compatible with her body. So we talked about what that would look like. She decided to go get a second opinion. The dentist who gave her the second opinion was less expensive. So she thought, I'm going to go, she just thought all things are created equal here. So I'll go ahead and have him do the work. And he started in her lower left area. Both of her molars had mercury fillings. He took those out. He did a wonderful job restoring the teeth, but after her numbness wore off, her teeth didn't feel right. Mm-hmm. And she went back. She had her bite adjusted 2 or 3 times. They got to the point where okay, it's not the bite. But she kept expressing, it doesn't feel right. And I don't know why. I mean, I'm hearing you say that the bite's right and it doesn't feel like the bite's off, but something doesn't feel right. Fast forward, she had a bunch of other dentistry done by another provider, which went horribly. Ultimately, she came back to me. She's like, I'm so frustrated. I've had half of these teeth now fixed. One of them's in chronic pain. Another 2 don't ever feel right to me. Mm-hmm. And I said, you know what? Might be a good time to press pause and let's do a biocomp analysis.
Yeah.
Come to find out that the 2 first, they were onlay restorations, a partial tooth coverage, ceramic, were made with a material that she was highly reactive to. And it was, although her teeth still felt weird, there was such a relief in understanding that she could now understand why it wasn't feeling right.
Exactly.
And I just love it because it now helps give us a nice guidance. And I really love, by the way, what you all have done with your tests. So for those people who've never seen a biocomp test, I mean, it comes as like a 250-page report. It's
double-sided.
It's massive.
Right.
It's so big. And I appreciate that maybe a year or 2 ago, you all started doing practice-specific summaries.
Yes.
So I send to you, here's the 50 most common products that we're using, and you do a cheat sheet, and then I can look at one page and say, okay, like the majority of what we
Providers love that.
And it's easier for patients to understand.
Yeah.
And it's interesting that I would say there are certain materials on the market which are highly popular in dental practices that consistently come back for every patient I've tested as being highly reactive. So what I would be curious to know is, what are the substances, not the brand specific things,
right?
But what are some of the substances that you see people being most sensitive to most of the time?
Okay. Well, let me start by just explaining a little bit about the test and how it works.
Perfect.
Okay. So just like our sister lab, DNA Connections, BioComp Labs can be found through your provider, through your dental provider, or you can do it on your own as a patient request. And we'll send you the kit. This one does involve a blood draw serum separation. We can help you find a laboratory to do that. They'll draw 2 vials of blood. We include the serum separation vials in our kit. They draw 2 vials of blood, let it clot, spin it down, separate off, and they send us the serum. That's the clear part of the blood, and that's where all of the proteins are. So we take your serum and we distribute it over like an experimental plate. And the plate has what we call analytical standards of these chemicals, like pure lead, liquid lead, analytical standards. And we distribute your serum, and the level of reactivity has a direct correlation to the amount of clumping or agglutination of those proteins that's in your serum. And then we have an instrument that measures the amount of agglutination. The more agglutination, the more highly reactive you are. And it's in its simplicity. I mean, serum agglutination assays have been used to assess reactivity levels, for years and years and years. The elegant and the simplicity of it is just, I find it just really fascinating.
Can I ask you, interrupt you and ask you a very ignorant question, but the agglutination that's happening in that interaction, is that also what is actually happening in the body when the serum part of the blood is interacting with these metals?
I don't know. It's a visual representation of how your body as a whole is reacting to something that it's highly reactive to.
And is that an immunoglobulin protein reaction?
It's a IgG response.
Okay.
And it's a measurable amount that we can assess to say, stay away from copper, stay away from mercury. Right. Yeah, I mean, some of them make sense. Like you just said, like, what are the things that people always react to? So we have 78. The majority of them are benign in people. Okay. We call those least reactive because this is all foreign. It's foreign materials in your body. There is no level of non-reactivity. So it's least, moderate, or highly reactive. And of course, aluminum, metallic aluminum is one of them. Mercury is one of them. A lot of people react to something called lithium. And so that is found in a lot of those zirconia restorations we've talked about. Metallic zinc. A lot of people call in, they say, does this mean I can't take my vitamins? So there's a difference between the metallic and the elemental, right? The absorbable, you're not going to eat like a block of metallic zinc, but zinc in your vitamins is elemental and absorbable. So it's different.
The same would be said about copper too. So we're thinking about some of these are essential minerals. It doesn't mean that the metallic form is safe for you.
Right. And then things that we see a lot are like lead, barium, cadmium. Doc, why is cadmium in some dental products?
You're asking the wrong guy. Not a material scientist.
That and cigarettes. How bizarre.
Right? Right. Well, and, the question that I get a lot that I really want to cover here is people call and they say dental implants. Okay. They say, I have a dental implant and I'm allergic to titanium. And I say, okay, I mean, it's possible. It is possible, but dental implants are not 100% titanium. If it's metal, it's metal, there's metal and ceramic. I'm talking about people, even me, are walking around with dental implants and they have no idea what's in them. Even me, I have 2 dental implants, couldn't even tell you. Right. Okay. So they say, oh, I'm allergic to titanium. And I say, well, okay, it's possible. But dental implants, metal implants are about 94% titanium. And it's those other metals that are mixed in that's what people are reacting to. And so getting a biocomp is so important before your dentistry. Right.
Everybody is freaking out right now, I think. And I'm freaking out right now. And because I've worked with you for a long time, knowing you run this test, knowing that this is something you do, never, ever thinking about fillings.
Oh, yeah.
Right. Well, and so this is one of the things that when people do come to us and we're talking about lowering risk, because and thank you for clarifying. I think it is an important point that anything that we put in that is foreign, there's no such thing as a non-reactive material. It's always going to have some risk. How helpful is that to know ahead of time whether it's least, moderately, or significantly reactive or aggressively, whatever the word is. What's the word? Severely?
Least, moderate, or highly reactive.
Highly reactive. Yeah. Thank you. That's an important thing to know because, as we were talking about earlier, the Emax material, and I'm not bagging on Emax by any means, but because it came out a little over 20 years ago, it answered the question in dentistry of how do we have something that is a ceramic material, it's bondable, and it's strong enough that it won't break under the load of chewing. And that's what they answered with that Emax material. It's a very pretty material, but it turns out because of the lithium in there of every biocomp test that we have run, that's one of the materials that comes back for every human being we have tested as a red X, highly reactive. And oftentimes, sadly, they've already had it glued into their mouth and they're exposed to it, not some of the time, but 24/7. They don't get rid of it. It's always in their mouth until I remove it or some other dentist helps them remove it. and then choose a material which hopefully would be biocompatible.
Yeah.
Are these materials, I mean, obviously they're isolated in the whatever was put into the mouth, but then are they always breaking down into circulation as well?
My understanding is that yes, you just like, even I think of like my plates and cups that Julie and I have had for about 30 years.
Yeah.
There's constant wear to
Yeah.
where the thing, and it depends on the material. Is it monolithic? Is it fabricated in a lab where it's homogeneous from one side to the other? Like we mill our crowns primarily. It's a homogeneous material that's polished. Are you, stacking the materials in a lab and then baking them and then putting some sort of glaze coating on the top?
So the rate of breakdown might be different, but
Yes.
there's potentially an isolated immune reaction happening,
Sure.
and then potentially a systemic immune reaction happening at all times.
Right. Right. And we're at the starting point. So we look at, say, a zirconia, like a block, right? And what's in that block. And, that's as it's manufactured. And I tell people, like, yes, it does break down. Like I grind my teeth. I grind my teeth hard. And so, it's even having that night guard in my mouth, for 12 hours a night, and I am grinding, I am breaking that down. So just like a night guard can break down, fillings break down, and I tell people, dental insurance will even cover a restoration every 5 years or so. They expect it to break.
Yeah. I mean, we watch people, I'm sure you've seen even friends' mouths where you can see the level of wear of their own natural teeth just living.
Yeah.
So clearly there's wear in particularly, I would say like composite materials, tooth-colored fillings, which lovely. It's great that you can bond that stuff to teeth, and provided it's relatively low risk for you, probably won't present a significant health risk, but it is, to your point, going to wear down.
Right.
It will require replacement, which brings me to a question I asked you a while ago, and I was because a patient asked. They said, okay, so I got a BioComp test done 5 years ago, or maybe for her it was 7. And she said, is it still valid? So if you would address for how long is a BioComp set of results helpful or usable?
Sure. Great question. In general, biocompatibility results are good for about 3 to 5 years. And the reason why is because not only does our biocompatibility change as we are exposed to things, as we do put restorations in our mouth, that can definitely change. As we age, women with hormonal changes or other metal introduced into our bodies, as we kind of break down like our teeth will, and you get like artificial parts and pins and hips and knees. The thing is that dental products change over time. And this is what is so important about BioComp Labs' commitment, is that we have this database of 11,000 dental products, and we have just a team of people that just research products. We're adding products to this database all the time. We also review products. And so what that means is we go to the manufacturer site, we pull these material safety data sheets. They're called MSDS or SDS, and it shows you the chemical groups that make up these products. Well, they change. And it's not like there's a big, colored flag waving to say, hey, we changed this particular line of composite. They don't tell anybody, they just do it. And so, or they'll change it enough to rename it and make like a satellite product in this product line. Somebody will call and they'll say, I use, as Dr. Blodgett brought up, I use Emax. Like, great, which one? There's like 30 of them. Right? So we review our entire database from top to bottom every single year.
Wow.
Every single year. And then, if you call me and you say, well, what's in this? I'll be like, okay, well, I'll look up this product and, there's 12 related products, and we vet them all the time, continuously. I'm always in that database. So 3 to 5 years for biocompatibility, depending on your age, your chronic conditions, what kind of products you need, there's always going to be something that you can find. Like if you said, you have your go-to composite and you're doing these fillings and that person happens to come up to be, moderately or highly reactive, there's always something else. And these are common products. These are available, across the country. And we also have an international database as well. There's always something that you're going to be able to find that you can source pretty easily for someone. If there's one of these people, they call in, they say, I'm just a reactive person. I said, oh, this is a great test. Do it before your dentistry, not after.
When I think about reactivity, just like complete layman, I'm like, oh yeah, those certain earrings, when I put them in, I immediately can't wear them, right?
Yep.
But if, as a clinician, but also as just a layperson thinking about what does reactivity feel like? So you're sitting here right now listening to this and you've got a bunch of stuff in your mouth. Who should be asking the question, am I reacting to what's going on in my mouth?
Sure. So the symptomology can be vague, can be diffuse. People ask me, like, what should I be, looking for? What should be, obviously burning, redness, swelling, bleeding, things like that. That's a highly indicative visual indicator that you are not agreeing with your dental work. But, something like, you were saying about your patient, Doc, that it just doesn't feel right. Mm-hmm. Like the bite's fine. I keep going in to get adjustment. It just doesn't feel right. Mm-hmm. You would know better than anybody. I have a crown. I have to get you to look at this, Doc. I'm like, it tastes weird. It tastes weird. Yeah. Mm-hmm. And that's enough to make me want to, even get in a dental chair to have it redone.
So since there's an immune reaction happening, you can have systemic effects. So you could have everything from muscle aches and joint pains and brain fog or whatever. You can have localized effects where something looks different, feels different, tastes different. Yep. So it could be a lot of things. So if you've got things going on in your mouth, which you're hard pressed to find somebody that doesn't at least have a filling.
Right.
I got one.
Right. Just one?
Just one.
I have a really strong relationship with Kelly because I've always said I'm never going to need him because I don't have wisdom teeth. I never had braces. I didn't get my first cavity till my first child was born. And now I'm just panicking over here for the couple of cavities I've had thinking, oh my gosh, am I biocompatible with my fillings? I don't know. But it is fascinating to think about so many of the chronic inflammatory responses we see in people, autoimmune conditions we see in people, that we're not checking this. You're checking this. I'm not checking this.
Well, by and large, I think all three of us could agree that the mouth is it's this place that it's ignored.
Mm-hmm. Yeah.
Like you can literally, if you look at our history, mercury fillings, for instance,
Who thought that was a good idea?
Yeah. Well, somebody a couple hundred years ago, which of course at the time probably weren't a lot of other great options either. But in today's day and age, with not only the advancement of materials, but the multitude of them, I have to say thank you to you and your team for what you're doing, because it is such an important and frankly, a simple window through which you can look, or a lens through which you can look to understand, okay, how do I keep my risk as low as possible? Mm-hmm. And I want, if you would please, share what is, thank you for sharing the blood analysis and what that looks like, but what does it cost? Is this like thousands of dollars to get this information, or what does BioComp charge a person to understand this information?
Sure. So the kit, the collection kit, shipping both ways, analysis and reporting is $350.
Wow. To me, that is like, let's say a crown at any dental office might be, I don't know, $1,000 or $2,000 or $3,000, whatever, a few $1,000s. $350 to know from like every dental material, almost every dental material on the market. I know there are a few companies who don't share their data, but the majority do.
Yes.
Yeah. So that gives you a very good sense pre-treatment, let's hope, to pick what would be compatible for you. I think it's just such a valuable thing for people to understand. I am curious because when I first started looking at compatibility issues, the first company name that was shared with me was a company called Melisa. And, I call you and text you so often because I come from a different world of psychology and such, and I didn't have quite all the biochemistry that so many of my peers do. What's the difference between what a test like Melisa is looking for and what BioComp is looking for?
So the Melisa can be used in a generalized sense. People always ask if we can extrapolate our results, right? So, because a lot of people have like artificial parts and pins. I think you have some in your ankle or your knee.
I have a knee replacement. Yes.
Yeah. And so, they ask if you can extrapolate the results. And so with our test, what you can do is you can say, well, I get a lot of people that say, I need a shoulder replacement. Say, well, okay, we don't have an orthopedic panel, but we certainly can, look at anything used in the body, is going to have a safety data sheet. And if you're highly reactive to copper, don't get a shoulder that has any kind of copper or lead or, anything that you're reactive to, because once it goes in, it's not easy to have a tooth replaced, certainly not easy to have your knee replaced. So what Melisa testing does, it is a immunological based testing like us, but just we use that serum agglutination. They use a different technology.
What I've noticed, because I think they have one that's like an implant panel or something like that, that gives you, I don't know, I'm guessing here, it's like 12 to 14 metals.
Yeah.
And it's fairly expensive. It was almost $1,000 or somewhere in that range. And when you and I were having this conversation a while back, I was kind of surprised to look at how many different substances was in the BioComp test.
Yeah.
And perhaps that explains why there's such a massive report that then comes back. Admittedly, it's related to dental, but
yeah.
To your point, Megan, like how many people don't have something dental that they've had done in their life?
Yeah. You would be the rarity, Doc.
Yeah.
Yeah.
I'm such a rarity.
I get that the report is massive, but we have a video on the website that it's under resources, and it's the BioComp Labs introductory video. And, it explains in 10 minutes how to read the report, how to best utilize the results. I still have doctors that call me and they go, what does this mean? I'm like, we've been working with you for 2 years. There's you just need to put a little bit, give me 10 minutes and I can explain to you how to best navigate this report. And if there's something in there, a product that you're looking for and you can't find it, I know where it is. I can find it. Easy.
And I have to say, you've been such a great resource to many dentists whom I've referred to you and to lay people as well. I've had lay people who ping me on Instagram and I'm like, call Dr. Douglas at BioComp. She'll be able to explain this to you. So I do encourage our listeners, if this is of interest to them, understand that you can be the conduit for this information for yourself.
Absolutely.
As I understand it, they don't even have to go through their dentist.
Right.
They could get the kit from you. They could go to a Quest lab or something like that, have it done, have the report, and bring it to their dentist. That's initially how I got exposed when people were bringing in their Clifford tests.
Right.
And I'm like, what is this thing? And I was like, oh gosh, this is actually quite helpful.
Right. Right.
That was kind of my original exposure, probably like 2013 or something like that. But what a wonderful piece of information as you are wanting the best care for yourself to offer your dentist, because it's easy for them to buy another, compule of composite that's compatible for you. I'm sure most providers want to do what's best for their patients.
Yes, you would think. Yeah, absolutely. I have a lot of patient request patients that find us on their own, and we can really help them because they say, well, what does my dentist use? I'm like, I don't know, but let's look it up in your report. Let's find it. And, they ask me like, how do the dentists pick these materials? And I say, well, it may be what they used in dental school. It may be what the rep says is on sale this month. I don't know.
Warning.
I don't know. So
it's on the clearance shelf.
fire sale.
And interestingly, great story is that we have these summaries that we make that are practice specific. Okay. So, and I'll have dentists, they'll go into like their ordering software and they'll just screenshot the whole thing and there'll be hundreds of products. Dr. Blodgett sent me his list of products and, we format it and I'm like, that's it? That's all you use? Are you sure? It's very short. Doctors that know, and still he's doing the BioComp to make sure that every patient is still compatible with those materials because, you just don't know what's going to work for every person. Every biocompatibility report is different.
Makes sense.
Yeah.
Wow.
Yeah, there certainly are products, and I think they've been designed this way, to be more compatible. There's more intentionality put into their chemical makeup. But to your point, that doesn't mean that's the case for everybody.
Exactly.
One of the questions that our oral health specialists ask our patients is, you were mentioning about earrings. And most women would know this. Are you able to wear cheaper earrings? Like you go to Claire's and pick up these, cutesy whatever things for $10. And boy, the people who react strongly, they know.
Immediately.
Oh, yeah.
Yeah, it's nickel.
Right. Now, and which brings up a point.
Okay.
Because for years, for 15 years, I was putting in titanium implants exclusively. That's all I knew.
Right.
And I've learned a lot having worked with you at coming to appreciate that every titanium metal implant has some component of nickel in it. The studies that I read, it's like, whether it's, 0.05% or 0.2 or whatever, it's present. And as interesting as I started reading through the BioComp, the full report, not just the summary, but the full report, there were a couple of brands I used to use with some consistency that come back as highly reactive for everybody I've tested so far. And of course, you don't know what you don't know.
Yes.
My opinion is that guessing when it comes to dental implant solutions is probably not a good, that's not a good approach.
Right.
So I would encourage people to consider getting a BioComp analysis. Maybe even put it on your list of like your checklist of health things you're doing every 3 years.
Yeah.
Update it. If you're somebody who has had dentistry, in the case that something happens, wouldn't you want to have that information for $350?
Right.
So if you average that, what's that, like $120 a year? To know exactly if something happened, what would you want to use?
Right. And I say, it's a small price to pay before the dentistry.
Yeah.
Right.
Before the dentistry. I've been involved with BioComp Labs for over 10 years, and we've only had one price increase by $25 a couple of years ago. That was it. Wow. That was it. And that, it includes shipping. So
it's so worth it.
Yeah, absolutely. Absolutely. Especially because, like I said, our biocompatibility changes, dental products change, and, your restorative needs are going to change.
Yeah. And the time and financial, and for a lot of people, emotional, psychological commitment to have dental work done. And then to come out of it on the other side and be reacting and not get the outcomes you want because the step wasn't taken is just, really sad and a scary option for a lot of people.
And avoidable.
Completely avoidable.
Yeah.
Completely avoidable. It's the first question I have when people call and they go, oh, I just found you, and how will this help me? And the first thing I said was, well, are you reacting to your dentistry, or do you have dentistry in your future? So, pretty much everybody, keep you in business, or it's going to have dentistry at some point in their future.
Yeah.
I was born without permanent bicuspids. Wow. And so when I was younger, like you said, years ago, that's what they did. They placed metal implants. So I have 2 metal implants. I don't know what they are. I kind of have this weird autoimmune thing going on, could it be related to that?
Yeah.
Probably.
Here's my card.
Yeah. Your next call.
I've already had my BioComp done.
Oh, good. All right. Check that box. So I know we could go on for hours. As we're coming to an end, one of the things Megan and I always like to ask our guests, as this is the Whole Health Podcast, is What does whole health mean to you, and what would you like to impart to our listeners?
Oh, goodness. Coming from a scientific point of view, whole health it's related to both of the laboratories that I'm involved with. So DNA Connections and BioComp Labs. It's from start to finish, what you're made of, what you put in your body, and how you react to your environment. And when I say how you react to your environment, it's all about your flora. You know, there are so many conditions that are related to what's in your mouth, related to the reactivity of the restorations that are in your mouth. And that's all related, again, to your flora, your whole overall health. So I think that just, keeping that balance in mind, being aware of your own body and the signs that it's giving you, whether you're reacting to dentistry or you're stressed and that's affecting your health, or if there's a chronic condition that could have a microbial component, to be aware and to keep it in the back of your mind that your whole health is everything, your environment, what you put in it, and what's part of you.
Definitely.
Well, thank you for traveling so far to be with us.
Oh, it was a pleasure.
This is great. You are a wealth of knowledge, and I really appreciate, our professional relationship and personal as well. You just, you're so approachable. And I always tell people that when I refer them to just call Leslie. She's so helpful, know? So thank you for everything that you and Dr. Gruby are doing. It's really important in our work, and we appreciate you.
Very rewarding to be able to, even if it's just one person is like, that's what it is. It's my dental implant. Mm-hmm. And they're going to call us on Monday. I mean, just even reaching one person, and it's so rewarding. Thank you so much for what you both do as well.
Thank you for sharing your expertise with us. This has been so fun.
Great. Thank you.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.